Hi again. Today we're going to talk about the dental management for the diabetic patient in our clinic. So this one will be the first part, and then we're going to do another lecture to talk about the dental management in diabetic patient by the dentist group. So we always get the question about the dental management of diabetic patient during the oral and the written exam. So we go through this video, and then we talk about what's the common type of question we're going to face during the exam. So maybe the first question will be, what is the pathophysiology of the disease? So what's the complication of the epidermolysis? It's too important to know about it. The other question is, what is the oral manifestation? The types of drug, dosage, frequency, route of administration is too important to know about it. And how you can detect the blood sugar level for the patient, what the type of the test, and last, what is your management for diabetic patient need dental treatment? So in this video, short video, we're going to talk about some of the questions that we already mentioned here, and then maybe in the next video, we're going to continue with the other type of the question. So the first question, what is the pathophysiology of the disease? Here we're going to go briefly about the type of the disease and the complication because we need to understand the characteristic of this disease, the pathophysiology, how the disease will cause complication, and then we talk about the dental management because we need to understand better about the kind of the disease. So we start with the type 1. Of course, as we know, we have type 1 and type 2. So for the pathophysiology of the type 1 diabetic patient, more related to the immune system attack, related to destroy the insulin producing beta cells of the pancreas. Whatever the cause, it is due to immunity or maybe due to infection. This all lead to destruction of the beta cells, which is responsible for the insulin secretion in the pancreas organ. So the beta cell deficiency lead to complete insulin deficiency, and this is we call autoimmune disease, where there are anti-insulin or anti-islet cell body will be formed, and this will enhance the lymphocytic infiltration and destruction of the pancreas cells. So we have an immune response that will lead to formation of the antibody, and this will enhance the lymphocytic infiltration to destroy the islet. In this simple diagram, we can see the beginning on the top, there will be gene destruction, or maybe there is gene or inherited, or maybe due to viral infection, microbes, or the other types that may lead to destruction of the beta cells, which is responsible, as I mentioned before, for the formation of the insulin. This will lead to hyperglycemia. As we know, the function of the insulin is to carry the glucose into the cells as a nutrition and fuel, and this will lead to type 1, type 2, and after that, of course, for the non-controlled diabetic and hyperglycemia sustained, they will cause complication we're going through in this video. So what about type 2 diabetes? When the examiner, they will ask you about what the pathophysiology of type 2 diabetes, how type 2 diabetes will be occur, and this we can answer as the body is unable to produce sufficient amount of insulin to meet the needs. This is the answer. So it means there is a production of insulin, but the production of insulin is not enough to cover the body need. So maybe also the beta cells will be deficiency and adjuvant or coupled with peripheral insulin resistance. Here we have another factor. There is peripheral insulin resistance. It means there is sometimes normal secretion of insulin, but we have peripheral insulin resistance. And the main cause also the obesity, as we know that most of the time occur when diabetic patient they are overweight, or most of the time occur about 50 years old, maybe increase in weight that will cause insulin resistance. So here simple diagram can show the type 2 diabetic. The cause may be the peripheral resistance, maybe due to obesity, and maybe to more secretion of the glucose from the uh, from the liver, or sometimes to some destruction of the beta cells, which is responsible for insulin production. The other question, what are the complications in diabetes mellitus patient? This is important because we need to know what the complication can be happen, what the consequences that patient have as the diabetic, and he's uncontrolled. So what's going to be happen? What the organ will be destroyed, and how the glucose will cause complication to the patient. The first and common complication is hyperglycemia. The patient is uncontrolled and is acute condition. And when we can call this hyperglycemia, when the glucose jump into more than 300 milligram or 60 millimole. So here the cells become progressively dehydrated, electrolyte imbalance, and lead to coma. And this more occur more in type 2 rather than type 1. The other condition is hypoglycemia, which is the opposite of hyperglycemia. Here, from its name, it means there is decrease in the glucose in the blood, and this one is more serious than the hyperglycemia. Why? We're going to know why. So it's also acute condition, and also the patient will maybe loss of consciousness and alter the patient condition and lead to coma, seizure, and maybe brain damage. This is why it is more serious and dangerous if you compare to the hyperglycemia. Sometimes will cause brain damage when we have severe decrease in the blood sugar and maybe lead to death if it is not managed properly. So why we get hypoglycemia? Most of the time due to incorrect time of insulin, or maybe take overdose of insulin, or maybe more than one, or maybe more than sufficient of insulin, and too much or incorrect time of exercise. As we know, the exercise will decrease the blood glucose. So maybe the patient taking insulin and is doing exercise, so there will be severe drop in the blood glucose. And the other thing, and important thing, is not enough food. The patient is only taking the medication without taking the food. This will lead to acute condition of hypoglycemia. What's the other type of complication of diabetic patient is diabetic ketoacidosis. This is also a acute condition, and this needs medical interference and is considered as emergency case. So the low insulin level can lead to liver turn the fatty acid into a ketone to get the fuel, because there is decrease of the insulin secretion, so the liver will take over and going to change or turn over the fat acid into the ketone as a fuel. So what the result, we get ketoacidosis. It's more common in type 1 rather than type 2. Ketoacidosis can lead also into hypotension and shock. Now we go to the other type of complications, microangiopathy. In a diabetic patient, we have micro and macroangiopathy, but we are more concerned as a dentist, we are more concerned about microangiopathy. What means microangiopathy? It means there is destruction of the small blood vessels. Small blood vessels that supply many types of organ in the body. One of them is the periodontal condition of periodontium that lead to periodontitis. As we know, we have progressive periodontitis in patients suffering from high sugar blood level or diabetic patient, and we get gum disease and periodontal destruction. So why we get microangiopathy? Why there is destruction of the small blood vessels in diabetic patient? Because the high blood glucose can go into the endothelial cells. As we know, the endothelial cells is the lining of the blood vessels. So these cells can take, usually, naturally, they are taking the glucose without insulin. So these cells will get more than the normal of the blood sugar, so we lead to cell destruction. The other thing also, we have thickening in the capillary basement membrane. This is the other thing, so it can decrease the lumen. So here we have destroy of the blood vessels. So you have to think in the exam, and you have to get conclusion that when you get a microangiopathy, it means what? It means less blood supply to the area. As we know, the blood supply will carry the white BC, the red BC, the red blood cell, sorry, and the fuel, the nutrition, the oxygen. So all this will be decreased. So most of the time we get hypoxia, we get necrosis in the area because of the destruction of the blood vessels. So in this diagram, simple diagram can be shown that is mellitus get complication. What's the complication? Atherosclerosis is most common in the micro. It means more common, atherosclerosis is more common in the large blood vessels that supply the heart and the other type of organ that need a big blood vessels. So it's affected by atherosclerosis, and also will affecting the small blood vessels that go to the eye, go to the nerve, and go to the kidney. That we call microangiopathy. So here the diagram will show more. We get acute complication, and we have chronic complication. The acute and chronic can cause the vascular complication, microvascular or macrovascular. The microvascular will cause retinopathy, neuropathy, nephropathy, while the micro, the big blood vessels, can cause coronary artery disease, peripheral vascular disease, and cerebrovascular disease. So the other diagram also will show the organ can be affected, the kidney, the eye, the heart, and also the blood vessels itself will be affected. And also, as we mentioned before, the periodontium, we are more concerned as a dentist, we are more concerned about the periodontium destruction and also the nerve, especially the peripheral nerve. We have another complication is immune compromise. The diabetic patient is immune compromised. So the glucose also affects on the immunity of the patient. We have decrease in the immunity for the diabetic patient. So we also more concerned about the immunity of the patient as like the patient needs surgery or surgery, need extraction, manual surgery. So of course, when the patient is more susceptible to infection, we have to manage it properly. So why the patient is immune compromised? Why the diabetic patient there is decrease in the immunity for this patient? Hyperglycemia will reduce the function of immune cells and also increase the inflammation. So we have two ways here: increase the inflammation and decrease the immune cells. So the diabetic patients are more prone to bacterial, fungal, viral, all type of the infection. As we know, the hyperglycemia will affect on the granulocytes like eosinophil, neutrophil. Neutrophil is too important in the initiation of the inflammation and initiation of immunity, and also the T cell function also will be affected. So here we have two types of cells will be affected in the diabetic patient: the granulocyte and the T cell function. Okay, the neutrophil function will be altered. So here the function of the neutrophil is not as usual, so be compromised. How? This will include adherence of the neutrophil, chemotaxis, the secretion of the cytokine, and the other will be affected, and also the phagocytosis of the cells. So all or most of the function of neutrophil will be affected from adherence, chemotaxis to phagocytosis. So the function of the neutrophil will be not as normal. Here we have pro-angiogenic granulocyte as research showing that the granulocyte has an effect on the formation of the new blood vessels from the original blood vessels. So here they show that the granulocyte, like neutrophil 20% and eosinophil 80%, has a role in the patient, has a role, sorry, for the formation of blood vessels. So a simple comparison between diabetic and control patient, they show that the diabetic patient there's decrease in the formation of the new blood vessels or angiogenic or angiogenesis, formation of new blood vessels. As we know, the blood vessels too important in the healing and formation of the new tissue, especially when you have a surgery, when you have a bone graft. We need the blood vessels formation to get a new tissue formation. So here we need to control the diabetic patient before we are going for any surgery, especially as we know now here it is clear that the diabetic patient will suffer from microangiopathy, will suffering from immune decrease. So here so the patient initiation for the new formation of new tissue or the defense mechanism, both of them will be affected. So here we understand that the neutrophil is not only working on the defense mechanism, not working only on the immunity side, but also working in the formation of new blood vessels. So we call it pro-angiogenic granulocyte. This is a special type of neutrophil. It's not same like normal neutrophil, as we know. They have different characteristic and function in comparison to the normal neutrophil. So they call it a different family, pro-angiogenic granulocyte, responsible for the formation of the new blood vessels. So in summary, the three main things we need to focus on it in understanding of the nature of the diabetic patient and complications too important. So here we understand that the diabetic patient is more susceptible to infection due to decreased blood supply, and the granulocyte cells will be affected, type of white BC. And the other thing also we have delay wound healing, also because of the decreased blood supply and the same cause of the granulocyte, as we understand that the white BC is not only defense mechanism, but also they initiate tissue healing, and also the patient subjected to hypo and hyperglycemia, which is significant in understanding of the dental management. We have to manage if the patient is hyper or hypoglycemia during the dental treatment, or when the patient on the dental chair. How are you going to manage? Of course, we're going to discuss the rest of this lecture in the second video. Thank you for your kind listening, and I hope you get benefit from this video. And please, you can follow us on the Instagram and Facebook, and also you can download our application from the Google to get more MCQ question. And we have more than now reach more than 800 questions in this app. Thank you for kind listening.